Hello, my name is Cayden I'm a first-year nursing student with Ontario Tech University, and today I will be demonstrating my final IV therapy spot test. Here's my student ID and the blank sheet of paper I will be using for calculations. So the first thing I would do before starting a patient on IV therapy would be to check the physician's order, gather my supplies, and then enter the room. So the physician has ordered 75 milliliters an hour of normal saline. So what I would need to take into the room with me is my 1000 milliliter bag of normal saline and the correct 10 drops per milliliter continue flow IV tubing set. So to calculate the dosage, I need to use the formula volume over time times calibration. Okay, so using the formula, I've calculated that I would need to administer 12.5 drops per minute, or 3.125 drops per 15 seconds, rounded to about 3 drops per 15 seconds. Next, I can calculate the TBA, which is when the bag will need to be changed. Okay, so I've calculated that I would need to change the bag in 13 hours. So if the shift started at 0700, the bag would need to be changed at 2000. Okay, so next I can set up the rate for 3 drops, 15 seconds. Okay, and then I zoom in. I can zoom in so you guys can see. so now that everything is set up, I will perform my system assessment. So I'm going to start by double checking, making sure I've administered the correct solution, which was normal saline, 0.9% sodium chloride. Going to make sure I have the right tubing. And I'm going to check the drip chamber, make sure that it was filled up to the drip line and that the infusion rate is correct. I'm going to check the patency of the tubing all the way from the bag to the patient, make sure all the clamps are unlocked and that there's no air bubbles or any kinks or collusions in the tubing. I'm also going to state the TBA, which is when the bag needs to be changed, which is in 13 hours. I'll check the insertion site on the patient. There's two major complications that I'm going to be looking out for, which would be infiltration, which is when the IV catheter becomes dislodged and starts going into the ICF. This would be characterized by coolness, pallor, and localized edema. Another common complication would be phlebitis, which is characterized by redness, edema, irritation, and inflammation, as well as the redness traveling superiorly up the vein towards the head of the patient. In both of these situations, I would, in the scope of a registered nurse, I would stop the infusion and then apply a warm compress. But in the scope of practice for a nursing student, I wouldn't touch the IV, but instead inform my clinical instructor or co-assigned nurse as soon as possible. Next, the tonicity of normal saline is isotonic, which means it would not cause a fluid shift in the patient. There are other solutions that are hypertonic, which causes a fluid shift out of the cells and into the blood, causing the cells to shrink. And there's also hypotonic solutions, which cause a fluid shift from the blood to the cells, causing the cells to swell. And then the main, where you would find the veins for IV insertion, you can do it on the right or the left arm. You have the dorsal metacarpal veins here that you can put the IV in, as well as cephalic or basilic. And I think that is everything. I'll zoom in on my math sheet so you can see.